Hello, Pulmonary Rehab friends. Julia O'Shea here to talk about bronchial hygiene. This is part 2 of the lecture. So the first part focused more on things to do to stay healthy, to avoid bronchial irritants, things like that. And so this one is going to focus more on pneumonia type of infections, the flu, and COVID-19. This is one of those lectures that will probably be outdated in a couple of weeks as we continue to learn more about what's happening in our world. But just wanted to share this information with you. So let's get started. Okay, so all right, let's start with pneumonia because this is something that anyone can get pneumonia, but it is a little bit more of a risk if you are someone who has lung disease. But basically, pneumonia is an infection in your lungs. It can come from, the most common type is bacteria, but it can also come from a virus or a fungi. It's a serious infection, which will start in the upper respiratory tract and then can eventually drop down into your air sacs where the environment contains mucus, and once the bugs get into that mucus, that's their happy place. They like to proliferate and create maybe excess liquid, pus, things like that, making it hard to breathe. So as I had mentioned, the high-risk populations are adults ages 65 and older, children younger than the age of 2, and then people with certain medical conditions such as lung disease, and then if you smoke. All right, in the picture here, you guys might remember from the anatomy talk, is showing the pneumonia in the right lower lobe-ish portion of the lungs, and you guys remember me talking about how that's the more common place where the pneumonia will settle in the lungs. Okay, let's keep going. All right, so how do you know if you have a pneumonia? So of course you'll have the symptoms, right? We've talked about those. And then your doctor or other healthcare provider may decide to order tests. So that could include a chest x-ray, which they would be able to see that on the film. It might be blood tests that either check your body's response to the infection, or maybe even checking the oxygen levels in your blood. And then, of course, the best way to test it is through a sputum culture. Easier said than done, but the sputum is the mucus that's deep down inside of your lungs, not to be mixed up with the phlegm or what you get in your mouth. So this is a specimen that you cough up that's from deep inside the lungs. And then they would send that to the lab, test it, and then they would know what type of pneumonia you have. How do you treat pneumonia? So if it's bacterial, you treat it with antibiotics. There's no treatment for viral pneumonia at this time, but viral pneumonia can also turn into a bacterial pneumonia. They also may have you eating better, drinking more fluids, getting rest. Maybe you need oxygen, you might need pain medications, management of the fever, even cough relief type of medications. Okay, so one of the best things you can do if you're in the high-risk population is to get your vaccine. This is designed to prevent Streptococcus pneumoniae, pneumococcal pneumonia, which is the most common type of bacterial pneumonia. And again, recommended for all people over the age of 65, and then anyone with lung disease. Okay, so how does this work? So you get your first dose of the vaccine, and then you get a one-time revaccination after 5 years. Recommended for persons aged 19 through 64 with any type of either chronic renal failure or immunosuppression type of disease. And then once you've received your 2 doses before the age of 65, then you may receive another one 5 years later. So that's if you got your 2 doses, so you get 2 doses. If you've gotten those before the age of 65, you may have to get another one after the age of 65. No further doses are needed for persons vaccinated at or after 65 years. It's a little confusing, but your doctor will keep track of your doses of when you get the first and the second. All right, just got to mention this. So with all vaccinations, of course, there's side effects. Sometimes it takes a couple days. You may not even notice, but of course there's soreness, redness, kind of almost the symptoms of the condition it's trying to prevent. So definitely let your doctor know if you're experiencing any side effects from vaccinations. Okay, what is the flu? So the flu, otherwise known as the influenza virus. So this is a very contagious respiratory illness caused by the influenza virus. There are 4 types, and types A and B are the most common in the human population that gets transmitted. And this is different than the coronavirus, which is why I'm separating this out. So this is kind of what we've dealt with probably, most people their entire lives. You have the flu season. It's usually starts in the fall and goes through the winter into spring. It can peak sometime January, February, and the symptoms can last 1 to 2 weeks. So here in the picture, there's the body aches, there's fever, there's the upper airway or nasopharynx, the runny nose, sore throat, and then of course the respiratory stuff, even the GI stuff, the vomiting, diarrhea, all of that stuff. So run-of-the-mill, well, I shouldn't say run-of-the-mill, but the flu. It can cause mild to severe illness and even death. It can lead to bacterial pneumonia, can cause ear, sinus infections, dehydration, very serious, worsening of other chronic health conditions. The World Health Organization estimates that 1 billion people get the flu every year, and then they estimate, this is a broad estimate, but 290,000 to 650,000 deaths occur from the seasonal influenza. All right, so the best thing you do is get your flu shots. So getting your flu shots reduces complications, reduces hospitalizations. Unfortunately, most Americans choose to skip the flu shot. That may be different this coming year with everything that's going on in our world. There's new strands every year that require yearly vaccinations, and it typically protects against 4 types of the flu viruses. So they're not perfect. Because you might get a type of influenza that your vaccination doesn't protect you against. So it's usually about a 50 to 60% chance that there's a good match between the vaccine strain that you were given and what's actually in the community. You usually get these shots in October or November, and it does take about 2 weeks to build up that immunity in their body. So sometimes people get the flu shot and they get sick. They catch the flu. Maybe they might have caught the flu either before they got the flu shot or while their body was still building that immunity. And it gets confusing because people then decide that, well, I got the flu from the flu shot, and that's actually not possible. So you may have gotten the flu during that period before your body had a chance to build up the immunity, or you caught a flu that wasn't in your vaccine. So it does get a little confusing. And then of course side effects again can come up with any vaccination. And I have seen people that have those reactions to the flu shot, and then they swear off the flu shot and they're never going to get it again. But it really is the best thing you can do to protect yourself from influenza. Okay, our hot topic, the coronavirus, or what we refer to as COVID-19. So Coronaviruses are a group of viruses that are common in both humans and animals, and it can lead to mild to moderate or severe respiratory illnesses. And the reason why it's called the novel coronavirus is that because this is a new strain that was just identified in 2019. So the COV is the coronavirus. The ID was identified in December of 2019 in Wuhan, China. And then prior to that, you may have heard it referred to as SARS-CoV-2. So that's the virus that is our pandemic right now. So I'm not going to get into too much detail on this picture, but I just want you to have a general idea of what's happening inside the lungs. So you guys probably remember in the anatomy talk when I described that the entire function behind our respiratory system is to exchange the oxygen and the carbon dioxide. So the top part here is showing the healthy airways, bronchi, and then it goes down to the microscopic alveoli or the air sacs. So here it's showing the healthy cell with the membrane and the red blood cells. So ideally, the oxygen passes through and gets picked up by the red blood cell, which carries it out to the rest of your body, and then the carbon dioxide gets dropped off. So there's a type 1 alveolar cell here, and type 2, which is the surfactant. So the type 1s are the part that is where the oxygen passes through, and then the type 2 is the surfactant, which is this gel-like substance that keeps the alveoli kind of nice and springy or prevents it from collapsing. So that's normal. All right, so say you are exposed to COVID-19 and the infection starts. So what can happen is that, you know, either you get it through talking to someone who has it, they cough or they sneeze, and it enters your airway. So it has to come in through the upper respiratory tract. It can take about 5 to 7 days before you exhibit any symptoms because it has to pass through that upper airway, through the trachea, through the bronchi, and then all the way down to the air sacs. So this is that period where you may not have any symptoms, and this is also that period where sometimes people we won't go to that extreme where it starts to affect their alveoli, and this what makes it so scary is that we don't really know at times if you've been infected or not. But say it does get down into your alveoli, what happens is your body does what it's good at doing, which is it starts to release these what are called macrophages or white blood cells to travel into the alveolus to basically start to fight off this virus. So once infected, if you start to advance to the moderate stage, that's where we start to see that immune response. So the inflammation, the fluid comes in, probably start to see lower levels of oxygen at this point because this fluid that gets in there prevents those molecules, the oxygen and the carbon dioxide, from passing through that membrane. And then what you hear about in the news is when people have the more advanced or the severe stage of COVID-19, which can lead to what we call ARDS or acute respiratory distress syndrome. So the acute respiratory distress syndrome is not new. This is something that people can get from the flu. You can get it from pneumonia. It's when things get really, really bad inside your air sacs, and there's there's this blockage or this inability to transfer those molecules, especially the oxygen. So all of a sudden you don't have enough oxygen in your system, and you might need advanced levels of support, such as mechanical ventilation, which is the ventilator, right? So that was the big scare, that we weren't going to have enough ventilators to support all of these people. So that's in the severe stages of what happens to your lungs. And there's so much more to it, but I'm not going to go super in depth on, you know, the physiology of the molecules, but just to give you a general idea. Okay, something that, so I found this chart from Yale New Haven Health, and something I started seeing pretty early on during the pandemic, especially when I was working in the hospital, was that the symptoms. So the symptoms of COVID can be very similar to the run-of-the-mill symptoms of allergies, cold, the flu, or even your pre-existing lung disease condition. So just briefly, I'll kind of run through. So allergies, probably the main similarities are going to be like the sneezing and the stuffy nose. Of course, if you get a cold, you're going to get the body aches, the cough, sneezing, sore throat, stuffy nose. With the flu, so remember, this is influenza, not COVID. Definitely the body aches, the cough, sometimes the diarrhea, and then the fatigue, fever, shaking, headache. And then when you get into COVID-19, that's where very similar symptoms. You have the cough, you have sometimes the body aches, the diarrhea, fatigue, fever, sometimes headaches. And then the other interesting thing with COVID-19 is the loss of taste or smell. So that's the one thing that stands out that these other ones don't have. So that's why you're hearing a lot about that in the news as well. But I just bring it up because it was, there was definitely, and there still are many times when people who have pre-existing lung disease have to go to the hospital, because that's just what happens when you catch a cold or get sick. And you still have to go down that same pathway to be checked out to make sure you don't have COVID-19. And luckily there's more testing available out there, so they are able to do this more readily. All right, so protecting yourself. So this is the most important part of the talk. And I mentioned this, it's the same stuff that I mentioned in part one, but washing your hands properly. So that 20 seconds, getting in there, all the nooks and crannies, the back of your hands, your thumbs, the creases in your knuckles, your fingernails. Thoroughly wash your hands, especially when you are not in your house. Your social distancing or physical distancing, whatever you want to call it. And, you know, they come up with the 6 feet rule, but I still think further than 6 feet is fine too. I mean, do what you need to do to make yourself feel safe. If you are in contact with loved ones or people who could be possibly carriers or not even know it, being outside is always better. Keep your distance, keep your hands clean, don't touch your face, wear your mask. You know, you guys know all this, you've been hearing this on the news. But I think it's especially important for someone with lung disease to continue to follow these rules. So right now it's June 1st in Vermont, and more people are going outside doing more things, which is great. But I don't think that that means that you need to just go along with the general public. I think you still need to be very cautious, make personal decisions on having close contact with grandkids, children, loved ones, things like that, friends. If you can continue to follow these rules, I believe that's the best way to continue to protect yourself. Okay, so that was kind of quick run through. When we have our classes on Zoom, I'm happy to open this discussion up and answer questions. Again, this information is constantly changing. There's new stuff coming out all the time, especially as we learn more about COVID-19. So stay up to date on what's happening in the world. Don't watch too much news because it's not always good for your nervous system. Remember, I talked about stress management. Use your resources, check in with me, with the physical therapist, and we'll do our best to keep you informed and educated on how to stay healthy. All right, that's all for now, friends, and I hope this was helpful, and we'll see you soon on Zoom. All right, bye.